Hello, everybody. So let's give students another minute to join. And we will be continuing to talk about Chapter 7. Please understand there will be a quiz this Friday, Quiz 4, over Chapters 13 and 14, Lab 5 and Lab 6. And I started making the quiz last night. Actually, I started making it several days ago, but I hadn't put it on Canvas. And I started it on Canvas last night, and I got about question 3 done. So I still have a lot to do on quiz 4. Any questions about what we're doing? In the second part today, whatever time that is, we will be discussing the unknown project, and you will actually start it. In fact, I emailed you the start of the unknown project last night. Meaning you should have your unknown number, and you will be doing that virtually. Any questions about any of this? If not, let's begin on Chapter 7, Controlling Microbial Growth. I believe this is the last slide we had discussed. So we're going to move on to chemical methods of microbial control. Few agents achieve sterility when we're using chemical methods of microbial control. Most simply decrease the microbial numbers to safe levels. They may remove vegetative forms of pathogens, meaning the parent cells. Few of the chemical methods remove endospores. Any question about that? So the chemical methods for disinfection are the compounds that you're familiar with in cleaning your house. Disinfection is the destruction of vegetative pathogens. It does not usually remove endospores. There are some agents that do kill endospores, and I'll briefly talk about those. Factors related to effective disinfection: the concentration of the disinfectant, also the time and the access to the surface to be disinfected. So generally speaking, the stronger the concentration of the disinfectant and the longer the time the disinfectant is applied, the better it will be. Any questions about that? The pH can affect the effectiveness of the disinfection. Generally, acidic pHs mean better disinfection. The presence of organic matter, which are often found in clinical situations, can also hinge on how effective the disinfection is. Many disinfective agents, like bleach, can become inactivated by organic matter. So generally, if there's no organic matter present, disinfection is better. Any question about that? One way of evaluating the effectiveness of a disinfectant is to use the Kirby-Bauer diffusion method. And it's not exactly the Kirby-Bauer test because we're not testing antibiotics. But you get an agar plate and you make a lawn of bacteria by streaking the plate at least 3 times, maybe 4 times, rotating the plate. We're not going to go through that procedure again. But you get the bacteria plated on the plate so it'll grow in a lawn. That means the bacteria will be growing everywhere. And then you allow the plate to dry for about 5 minutes. and then you put the discs on that have a chemical in them, and they should have a certain number of units of the chemical in the disc, and then you incubate that in the incubator, and the bacteria will grow where the chemical does not hinge its growth. And then where the antibiotic, or not antibiotic, the disinfectant diffuses, you'll get a zone of inhibition if the disinfectant reacts with the bacteria. Now you can see the different bacteria, like Staphylococcus aureus, all of the chemical agents we tested, had some zone of inhibition. Some of them, this one and that one, were quite good. But some of the bacteria, like the E. coli, it definitely was much less on working for E. coli. Like this one didn't work at all. And these two worked, but only a little bit. So only chlorine, probably chlorine bleach, is the one that gave a large zone of inhibition. And then when we look at Pseudomonas aeruginosa, the only one that had any zone of inhibition was chlorine. Okay, so different species of bacteria show different sensitivity. And probably the major difference here is whether or not the bacteria has the outer membrane to its cell wall. The gram-positive one did not, and so all of them were sensitive. Pseudomonas does have an outer cell wall, and only chlorine was effective. So you just soak the paper dish from the chemical and then incubate them. This method is used with antibiotics, but antibiotics are not considered disinfectants, and here we're testing different disinfectants. Now this test is not a very good test to test a disinfectant because we do not usually work with disinfectants where they are diffusing out across agar. Usually when we're applying disinfectants, we're cleaning a surface of something with the disinfectant. So understand that this test is not testing the disinfectant in the way that we're using the disinfectant. Is that clear? We don't test the diffusion of most disinfectants, okay? All right, there are different types of disinfectants, and this is a list of the different types. We'll talk about each of them. I think I'm not going to read it because it's a large number, and you can just read that if you want, and we will talk about each one. Any questions? So this is a summary table of the chemical agents. You only need to look at the first 3 columns. The first agent we'll look at is phenol, and it is rarely used because it's not very effective as a disinfectant, but it's the one that was first studied by, who was that? Lister? And so it may be used as a comparison for all the other disinfectants. And its mechanism of action is it disrupts plasma membranes and denatures proteins and enzymes. Phenolics are compounds that are derivatives of phenol, and they have the same mechanism of action, disruption of plasma membrane, denaturization of enzymes, and they're applied to environmental surfaces, instruments. You can apply it to skin surfaces and mucous membranes, and they're much more effective than phenol. Bipheноls also are chemical derivatives of phenol. Their mechanism of action isn't entirely certain, but they probably disrupt plasma membranes. And they are disinfectants in hand soap and skin lotions. Biguanides like chlorohexidine disrupt plasma membranes. They can be used on skin disinfection and are especially used for surgical scrubs. So what surgeons scrub with when they are preparing for surgery. Halogens, these are common disinfectants, and you've probably used iodine. If not, you've gone to the clinic and they put iodine on your skin. It inhibits protein function. It's a strong oxidizing agent, and the most commonly used halogen is chlorine, such as chlorine bleach, forms a strong oxidizing agent which alters cellular components, and the active ingredient is hypochlorous acid in bleach, but we'll just call it bleach. Iodine is used as a tincture, but you can use it as an iodophore. Chlorine gas is a halogen which is used to disinfect water, or like in swimming pools. Chlorine compounds are used as disinfectant, like cleaning dairy equipment, eating utensils, household items, toilets, glassware, you name it. Meaning bleach is used on almost everything. Alcohols, they denature proteins, but they also dissolve lipid membranes. They're used to clean thermometers, other instruments. They're used to swab the skin before an injection. Most of the disinfecting from the use of alcohol probably comes from simply wiping away the dirt and some of the microbes. And we call that degerming, where you don't really clean the skin when you're swabbing with alcohol, but you degerm, you reduce the numbers of bacteria to safe levels. Heavy metals and their compounds are used to denature enzymes and other essential proteins. They once were used frequently, and their use is starting to come back, like silver nitrate used to be used to prevent gonorrhea infections in the eyes of neonates, meaning ophthalmia. Sulfur or sulfamide used as topical creams and burns. Copper sulfate is still used today as an algicide. And I think it's silver nitrate that they're using that now on like treating dressing to stop a patient's wound from getting infected. So it's coming back, especially in the clinic, the use of heavy metals. They were not used very much because the heavy metals really are toxic. And so they stopped being used for a while, but like I said, they are coming back, especially in clinical settings. Surface active agents like soaps and detergent. Mainly it's a mechanical removal of microbes through scrubbing, like when you're washing your hand, used for skin degerming or removal of debris. Acid anionic sanitizers, not certain of exactly how they're working. They're sanitizers in the dairy and food processing industry. I'm not even certain what an acid anionic sanitizer is. I've never used them. Has anyone had experience with one of those? I know it's a non-alcohol sanitizer, but I'm not sure how they work. And like I said, it appears that they're not well studied because their mechanism of action is not certain. Quaternary ammonium compounds like cationic detergents inhibit enzymes, denature proteins, disrupt plasma membranes. They're an antiseptic for the skin, and they're used to clean instruments, utensils, rubber gloves, and sometimes they have a use in the clinic, like for sterilizing surgical instruments. These are chemical food preservatives. Organic acids are actually added to food to prevent the growth of microbes, and they stop metabolic inhibition. They mostly affect molds, inhibiting the molds from growing. Their action is not related to their acidity, meaning they are slightly acidic, but it's not acidic enough to prevent the growth of molds. Sorbic acid and benzoic acid effective at low pH and prevent the growth of mainly molds. Parabens, much used in cosmetics. Sometimes they're used in shampoos, and then calcium propionate used in bread to prevent the growth of mold. Any question about organic acids? Obviously, shampoo and cosmetics are not food, but most of them are used in food to help preserve the food. Nitrates and nitrites, very common food additive, which stops the bacterial action. Nitrite is the active ingredient. It inhibits certain ion-containing enzymes and anaerobes, and it's added to a lot of meat products like ham, bacon, hot dogs, and sausage to prevent them from spoiling. And I should say, you don't want to keep these in the refrigerator for much longer than a week, but these additives do help prevent them from spoiling. Any question about that? And I should state that ham and bacon, because they have salt in them, they can keep in your refrigerator for longer than a week. And just read the pull date. It tells you how long to keep them. And most of the salt is nitrites, but there's other salts in ham and bacon as well. Aldehydes cause proteins to denature. Examples, glutaraldehyde, like Cidex, which is less irritating than formaldehyde, and it's used for disinfecting mostly medical equipment. Some of these can also be used to preserve tissue, like you put tissue in formaldehyde and then it will stay, for many years. I'm not sure how long it lasts, but specimens have been preserved for certainly decades in formaldehyde. Any question about formaldehyde or glutaraldehyde? Chemical sterilization happens. You can use a gaseous agent like ethylene oxide and other gaseous sterilants. They inhibit vital cellular functions, mainly for sterilizing materials that would be damaged by other sterilizing techniques like applying heat. So sometimes in the clinic they'll expose things to ethylene oxide. I doubt most of you remember this, but somebody sent around spores of Bacillus anthrax in the mail, and how they sterilized those letters was by ethylene oxide exposure. Plasma sterilization, I'm not entirely certain what that is, but it inhibits vital cellular functions, and it's used mostly in the clinic, but to sterilize or clean tubular medicinal instruments. Can anyone speak about what plasma sterilization is? Anyone worked in the clinic and you've been exposed to that? Nobody wants to comment? Like I said, I don't have any experience with that. Supercritical fluids, also inhibiting vital cellular functions, useful for sterilizing organic medical implants. So like if you have like a heart valve, they sterilize it in a supercritical fluid before they place it into a patient to replace their heart valves. Any question about that? Peroxygens and other forms of oxygen, their mechanism of action is oxidation, and an example of that would be hydrogen peroxide. This is used for cleaning contaminated surfaces. You can put it in some deep wounds, and they're very effective because they work against oxygen-sensitive anaerobes, and this is about the only chemical agent that is effective on endospores. So the peroxygens, like hydrogen peroxide, does kill endospores. And like I said, it's about the only one. Bleach can kill some endospores, but it doesn't kill all endospores. So there are some that can work, but this is one that works across the board on endospores. So this is something that actually can sterilize. All right, any question about the, oops, where the heck are we? Right there. Any question on the chemical agents used to control microbial growth? All right, so that was just a summary. Let's talk about each group now. Phenol and Phenolics. Phenol was first used by Lister. You don't need to know when he did, in 1867. And he used it to control surgical infections. And he used it on his surgical instruments and on the skin of his patients. He was about to undergo surgery. It's not used anymore. For one thing, it's not a very good disinfectant. And it's also irritating to the skin. It has a disagreeable odor, and it actually is a carcinogen. So you'll be pleased to know that we don't use that on patients anymore. Okay? And it also was corrosive, like on the surgical instruments. And you could treat them with phenol a couple of times, but then it would start dulling or rusting the blades for most metals. Stainless steel was more resistant than steel, but it would eventually rust the blade even of stainless steel if you did it enough times. Phenolics are chemical derivatives of phenol. They damage lipid membranes and plasma membranes and denature proteins. A good thing about phenolics is they are active even in the presence of organic compounds. So for cleaning up messes in the hospital, phenolics are often used because they are effective when organic compounds are around. They're also fairly stable, and they persist for long periods after they're applied. So they're suitable for disinfecting pus, saliva, blood, and feces, which all of these have a lot of organic matter in them, besides the bacteria of interest. There we're looking at the chemical formula of phenol and just one of the phenolics. And as you can see, it's similar to phenol but different. Any question about this? Bipheноls, another derivative of phenol. They contain a bridge connecting two, phenolic compounds together. Their mechanism is mainly they disrupt plasma membranes. An example, hexachlorophene, right here. Used in prescription lotion for surgery in hospitals. You can also, you're not supposed to use it to bathe in for an infant because there's a danger of the infant swallowing that. It's also triclosan, used in disinfectant and hand soaps. Any question about bipheноls? Biguanides, like chlorhexidine, disrupts the plasma membrane. It's a very good disinfectant for the skin, and it's sometimes used in preparation for surgery. It has a broad spectrum of activity, meaning it works on many different bacteria species. Halogens, very common household agents, effective as antimicrobial agents both alone or as a constituent of an inorganic or organic compounds. Iodine, widely used, impairs protein synthesis, a strong oxidizing agent. You can use it as a tincture, like tincture of iodine. It's a solution in an aqueous alcohol, and you just put it on the skin. And it used to be very common before surgery. There's now more modern agents that they sometimes use, but like in the 1960s, this is something they used before surgery all the time. It's still used today, especially if it's a minor surgery. It can be used as an iodophore combined with an organic molecule, in which case the iodine is slowly released. An example of that is betadine. It's also available in tablets, and I've used these tablets to purify, iodine tablets to purify drinking water that had potentially been contaminated. Another halogen is chlorine. Chlorine gas is widely used as well as in combination with other chemicals, like to sterilize water. They will do chlorine gas. I think it's chlorine gas which is added to most cities' drinking water. Germicidal action due to a hypochlorous acid forming, a strong oxidizing agent that disrupts enzyme functioning. It's also used, chlorine, in bleach. The active ingredient is sodium hypochlorite. Chloramines, another example of halogen using chlorine, consists of chlorine and ammonia, and that's used as a disinfectant or an antiseptic and a sterilizing or sanitizing agent, sanitizing agent to sanitize something that you're cleaning, meaning it doesn't sterilize it, but it helps clean it. Any question about any of this? Alcohols effectively kill bacteria and fungi, but they do not do anything to endospores, and they are not very good at killing non-enveloped viruses. So if the virus has an envelope, alcohol is very effective at denaturing the proteins and dissolving the lipids in the envelope of the viral envelope. So alcohols are very good at killing envelope viruses. And they're good at destroying the plasma membrane of cells. They also act by denaturing proteins. So they will denature a non-enveloped virus, meaning a naked virus, but you have to use a lot of alcohol to thoroughly denature the naked viruses. Okay? It's unsatisfactory alcohol for wound care because it also causes protein coagulation. So it's not usually suggested that you dump alcohol in an open wound, that it's better to use a modern chemical disinfectant or antiseptic for wound care. It would be effective in the sense that it would kill the bacteria causing an infection, but it'll also cause damage to the wound. Any question about that? The two most common alcohols for disinfection are ethanol and isopropanol. The best effective alcohol concentration is 70%, meaning 70% alcohol works best. And that's true for isopropanol and ethanol. And let me see if I can show this a little better. From this slide, we're looking at different alcohol concentrations, and you can see that the effectiveness of 100% ethanol was not effective for even 50 seconds of exposure. And then 40% ethanol for even 50 seconds of exposure was not effective. So the best concentration of ethanol, which actually was effective even at 10 seconds of exposure, was 70% ethanol. But around 70% ethanol is also good, like 60% and 80%. And it's somewhat surprising that the higher up you go, although this graph isn't showing it, that 95% ethanol is not as effective as 70%, and the 100% is the least effective. Okay? Any question about that? And this slide, I don't know how it got messed up, so I'm going to move it out of the way. Alcohol is effective in killing bacteria and fungi, but not on endospores, and also not really on naked viruses. Acts by denaturing proteins and dissolving lipid membranes. I think I see why. I've already talked about this, haven't I? Causes protein coagulation. All right. That's why that slide has it. I've already given it. Let me put that back. About right there. All right. Any question about alcohols? If not, we'll move on to heavy metals. They can be biocidal or antiseptic. Some examples of heavy metal which are useful: silver, mercury, and copper. And you really only need small amounts of the heavy metals for them to be effective. As this plate is showing you, each of them, although it's very small, the area where there's a zone of inhibition, but as you can see around this dime, and see how that's an old dime? It's because it has to be 100% silver for it to come out. And that's an old penny because it has to be made of copper, and today's pennies are mostly not copper. And I have no idea what that is, but I'm assuming it's probably silver, but it could be mercury as well. I'm not sure what that is. And it looks like somebody moved the locket, but as you can see, it did prevent the growth of the bacteria. And it's not a big zone of inhibition around both of these, but it is demonstrating that there is a zone of inhibition from heavy metals. Okay? Any question about that? You need very small amounts of the heavy metal because when you put a dime on the plate, not many heavy metals are going to come out of the dime and then diffuse across the agar. The metal ions combine with full sulfhydryl group and proteins, resulting in the protein denaturation. Any question about that? Heavy metals were mostly, until recently, stopped being used because they are toxic to us as well. But like I said, their use has come back because, like in surgical dressing, the hospital doesn't want the wound to become infected, and so they sometimes will dress the dressing with heavy metals to prevent the bacteria from growing. And so their use has actually come back. Silver, like 1% silver nitrate. It used to be used in the eyes of newborns to prevent them from getting infected after they were born. I don't think that's used anymore. But there's renewed interest, like I said, in silver impregnated dressings. You can get silver sulfadiazine in a topical cream for a burn. And they put it into catheters as well as wound dressings to prevent infections when the catheter is used. Inorganic mercury compounds like mercury chloride, effective as a bacteriostatic agent. It now has limited use because mercury chloride is actually very toxic to people, and it's also corrosive. But it is used in paints to prevent them from, I assume, getting bacteria to grow in them and causing them to spoil. Copper, it's still used as an algicide. I once used that in my incubators, and we put it in the incubator to prevent the algae from growing in the incubator. Zinc, it's a heavy metal used in house shingles, and I never knew this, but apparently microbes grow on the house shingle and then cause them to corrode, and so they put zinc in house shingles to help keep them better for longer periods of time. Any question about any of the use of heavy metals? Surface active agents, surfactants, like soaps and acid anionic detergents, decrease the surface tension of molecules in a lipid, and that harms the bacteria in the lipid. Like soaps emulsify oils and are used to degerm surfaces, like when you're washing your hands, but it can be used to degerm the skin, as well as they wash the contaminants off of the skin, and the water and the soap help clean your skin. Acid anionic sorry, I'm not saying that word. Acid anionic detergents, sanitizers that are used in the dairy and the food industries, and I can't talk much about that because to my knowledge, I've never used them. Okay, I've used non-alcohol based sanitizers, but I don't think they were acid anionic detergents. There are sanitizers used in the dairy and food industries, and I have no idea why they use them, but I assume that these, if they get into food products, they're probably not toxic. Quaternary ammonium compounds, also called quats, they're the most widely used surfactants in the hospital. They can be used in the home as well. Cepharin, Cepacol. The chemical mode of action is uncertain, but probably disrupts plasma membranes. They can be used as an antiseptic for the skin, cleaning surgical instruments. They can be used to clean utensils and rubber gloves. Strongly bactericidal against gram-positive bacteria, but they're not as strong agents, meaning they're less active against gram-negative bacteria. And then some Pseudomonas species will even grow in quats. So in the hospital, they have to make sure that the compound has not been around for a long period of time, because Pseudomonas can actually grow in them. All right? Now there's an ammonium ion, and the quats have that ammonium ion on the quat. Benzalkylene chloride is an example, and the ammonium could be attached to this side here. All right, any question about surfactants? If not, let's move on to chemical food preservatives. They're added to foods to retard spoilage, like sulfur dioxide is added to wine to keep the wine good for a longer period of time. They generally inhibit metabolism, mostly of molds, but like sulfur dioxide in wine can also prevent certain bacteria from growing in the wine. They're common food preservatives like sodium benzoate, sorbic acid, calcium propionate added to foods. They are generally not toxic. Organic acids or salts of organic acids, the body can metabolize them, but they prevent molds from growing. And they're judged to be safe in food. And so a lot of prepared food has them added to them. And it's to keep the food from spoiling for a longer period of time. Let's go back to that. Sodium benzoate, sorbic acid, calcium propionate. Some of them are added to bread, cheeses, many prepared foods. Just read the ingredients and you'll come across some of these. Antibiotics. They're a method of microbial control. Other antimicrobials mentioned in this lecture are not. They're used for ingestion or used to treat disease. Antibiotics are used for this purpose. Some antibiotics are actually added to food as a food preservative, like niacin in cheese. It will prevent bacteria and mold from growing in the cheese. Nitasamycin, it's added mostly to cheese, but to other food as well, to prevent certain things from growing in the food, especially mold. Okay, so yes, antibiotics can be added to food, and niacin is the most common, nitamycin, and mainly they're added to cheese. Okay, and so when you're eating cheese, you may be eating an antibiotic. They're mostly added to soft cheese. Okay, any questions? Aldehydes, they're among the most effective antimicrobials. They inactivate proteins by forming crosslinks in the functional protein groups, such as the amine group, OH groups, the COOH group, the carboxyl group, and the sulfhydryl group. Some aldehydes include formaldehyde, which is a gas, formalin, a liquid, and they're excellent disinfectants. Glutaraldehyde is a very common disinfectant. It's a liquid, and it's used in the hospital environment to help disinfect surfaces and objects. Any question about the aldehydes? Like I said, formaldehyde can also be used to help preserve specimens, and I would assume that when you're in formaldehyde, besides preserving the specimen, it keeps the bacteria from growing in the specimen. There are various gaseous agents that are used as chemosterilizers, chemicals that sterilize a closed area, so they usually have it in a chamber, and then you add the gaseous agent to the chamber. These gaseous agents denature proteins. The object is placed in the chamber, and then the air is replaced with a sterilizing gas. The most common one is ethylene oxide. It actually kills all microbes and endospores. Although to kill endospores, you have to expose the endospores to ethylene oxide for a long period of time, 30 minutes or longer, depending on the endospore. But it is effective on killing endospores. It's used for sterilizing objects that would be damaged by heat or liquids. So certain medical supplies, the sparecraft, electronics. I don't know why you'd sterilize a mattress, but if they want to sterilize the mattress, they use a gaseous sterilizing agent. And I would assume you have it in a closed room, and you put the gas in the room to sterilize the mattress. Maybe they do that like in a hospital ward where a patient has a really horrible disease and they don't want to put another patient on that mattress. So they sterilize the mattress with a gaseous agent. Peroxygens, this is the one chemical disinfectant besides ethylene gas which can kill endospores. They're oxidizing agents, oxidize cellular molecules, and they can be useful for irrigating deep wounds. Like if somebody has a deep wound, you can pour in hydrogen peroxide to help clean the wound. And it doesn't do much damage to the wound, but it would kill endospores and anaerobes very effectively. It would kill other bacteria too, but my point is it would kill endospores. Ozone is a peroxygen, pericritic acid, an excellent sporicide, hydrogen peroxide, which can be found in many homes. It's an antiseptic. It's not that good for open wounds, but it can be used. It is useful in the deep wound because it would kill off anaerobes very easily. And it's also effective in disinfecting inanimate objects like fomites. Like I said, and it can kill endospores because most endospores are sensitive to oxidizing agents, meaning they're sensitive to oxygen. And so that's why they're very good at killing endospores. Any question about the peroxygens? All right. Comparing the effectiveness of various antiseptics is what this slide is showing you. Let's blow that up a little bit. So the percentage of bacteria surviving at a given time at 1 minute, soap and water has not killed too many organisms. Soap and water is not a very good disinfectant. Really what it's only good at is de-germing, helping to wash away the germs and then the grime on your skin that the germs might be attaching to. And as you can see, even with 2 minutes, what is that? 90% of the bacteria are surviving, even at 2 minutes. And I don't think any of us wash for 2 minutes. Okay? Aqueous safranin, a little better, but still not very good. Tincture of safranin, much better. At 2 minutes time, the killing is below 20%. And then 1% iodine, meaning tincture of iodine. In only 10 minutes, we have 20 seconds, sorry. Don't ask me why I said 10 minutes. 20 seconds. You have a 60% kill rate. And then at, 90 seconds, it looks like, you have a kill rate of 90%. Okay? And the good thing about tincture of iodine, when you treat the skin, that is active for a long period of time on the patient's skin. So generally, when they treat the skin of the patient, the iodine is on the patient for a long time, at least 10 minutes, before the patient goes into surgery. Okay? Any question about any of that? We are doing okay time-wise. Microbial characteristics and microbial growth. This is a simple hierarchy showing you the relative resistance of major microbial groups to chemical biocides in general, meaning not specifically to all chemical disinfectants, but in general. For example, mycobacteria has mycolic acid in it, and generally it's resistant to most disinfectants. The reason being is most disinfectants are water soluble, and because of the mycolic acid of the mycobacteria, most disinfectants will not be effective on mycobacteria because they can't get through the cell wall of the mycobacteria. Any question about that? But then alcohol, which is not a very good chemical disinfectant, so it's like not very effective, it's actually very good at killing mycobacteria because alcohol gets through the mycolic acid and then goes in and denatures the proteins in the cell. Do you see my point? So this is in general, but specific agents which are not very good can kill mycobacteria like ethanol. Okay? So when we're talking about things in general, we can put the most resistant things on the top and the least resistant things on the bottom. So generally speaking, viruses with lipid envelopes are the easiest to kill. Gram-positive bacteria, the next easiest to kill. Viruses with envelopes are the next easiest to kill. Fungi, including fungal spores, the next easiest thing to kill. Gram-negative bacteria, the next easiest thing to kill. And why they are so much more difficult to kill than a gram-positive bacteria is simply that the gram-negative bacteria have an outer membrane around the cell. And this makes them much more difficult to kill by most, not all, chemical agents. Any question about that? Vegetative protozoa. The cysts of protozoa are much more difficult to kill than a normal protozoa. We will talk about protozoa in our last lesson when we're talking about parasites, but generally the cysts are harder to kill than the parent. This is a reproductive, chemically active, moving, perhaps, protozoa. And then this is one that is in a cyst, and it's less active metabolically, and so it's much more difficult to kill. And generally, the cysts are what survives when it's ingested by a host, whereas the vegetative protozoa, most of the stomach digestive acids and juices will kill the vegetative protozoa, but not the cysts of a protozoa. The mycobacteria are then, generally speaking, more resistant and harder to kill than the cysts of protozoa. The endospores for living organisms are the most resistant life form. They're very difficult to kill. There's only a few agents that are effective at killing endospores. And the peroxides and hydrogen peroxide was one that I talked about specifically, will kill endospores. Okay? And then prions are the thing most resistant. To kill prions, you need to heat them to 1,000 degrees Fahrenheit. And that would incinerate any protein. Okay? So this is the hierarchy. As I stated, some things like ethanol can kill mycobacteria and fairly effectively, even though alcohol is not a very good disinfectant. And then with hydrogen peroxide, which is an excellent disinfectant, it would not be very good on mycobacteria because hydrogen peroxide would have a hard time getting through the mycolic acid. But it is actually very good at killing endospores. Anyone see the point of that? Okay, so the endospores generally are very resistant, but to hydrogen peroxide they're very sensitive. Although hydrogen peroxide would be good at killing this and this and that and that and that and that and that. I'm not sure exactly how good they are at killing viruses, so I might be wrong on these and that. Hydrogen peroxide, would that work on lipids? I'm not sure. I'll have to look that one up. I'm not sure how good it is on killing viruses, so maybe I should hold off on talking about killing of viruses with hydrogen peroxide. So realize that specific agents may act differently than this general comparison. All right? I've already talked about it. Biocides tend to be more effective on gram-positive bacteria than gram-negative bacteria, and that's because the gram-negative bacteria have an outer membrane which helps protect the bacteria. Whether the gram-negative will be sensitive to the disinfectant will be dependent, and if the disinfectant can get through the porin molecules of the gram-negative cell wall. Mycobacteria also are resistant to many of the biocides because of the mycolic acid in their cell wall, and that's why we have it way up here. But realize that things like alcohol are very good on mycobacteria. Only a few of the biocides work on endospores, such as the peroxides and the sterilizing gases can work on endospores. Not much else is effective on endospores. Any question about any of that? So what works on prions besides heating to 1,000 degrees Fahrenheit?
Apparently nothing else.
Not much else. Actually, there are a few things. Let's talk about that in a minute. Actually, I talked about it, so let's move on to prions. Infectious proteins that cause spongiform encephalopathies. They are the most resistant things. What we use to kill prions, it's not completely solved because they are so resistant to being treated. Actually, they do incinerate carcasses, like this mad cow. How the British destroyed their cattle was they incinerated all of them. You can't do that to things. Like, what do you do with surgical instruments if you're concerned that you may have worked on a prion-infected patient? Okay? The World Health recommends autoclaving won't sterilize the surgical instrument. The World Health recommends combining sodium hydroxide and autoclaving. The trouble is sodium hydroxide is corrosive, and you have to expose the surgical instruments to it for 60 minutes and autoclave at a little bit higher temperature, 136 degrees Celsius. The best thing to do if you're working on a patient who might be prion infected is to use disposable instruments and then just get rid of them, okay? But there is one treatment that seems to work on prion-infected stuff, like surgical instruments or surgical tubing or any other hospital tubing. And that is, you can treat it with a protease solution. A protease digests proteins, and prions are made up of proteins. So the surgical instruments, if you treat them with the protease, you can clean them to prions. And that seems to be a solution for treating prions. Any question about that? Because proteases work at, like 37 degrees Celsius. They're at body temperature. All right, let me go back to this slide here. Viruses. They're not especially resistant to biocides. A lot of biocides work on viruses, but there is a difference in the resistance seen between enveloped viruses and, enveloped viruses and non-enveloped viruses, that the envelope of the virus tends to make it more susceptible than the naked virus. So we can destroy the envelope of the virus, and then if that's all we do, like with generally even hand washing, destroys the lipid of the envelope virus. So your hand washing, come on mouse, my mouse is dead here. Okay, my mouse finally came back to life. The simply hand washing can destroy COVID-19. That's why they suggest hand wash for 20 seconds. The soap of your hands will destroy the lipid envelope of COVID-19, making COVID-19 non-infective. And so the lipid envelope of viruses makes the virus more sensitive than a naked virus. But naked viruses are fairly easy to destroy, because anything that will denature proteins will denature the viruses, like alcohol for exposure. As long as you have the exposure long enough for naked viruses to the alcohol will denature the proteins of the virus, and that'll destroy the viruses. All right, any question about any of that? So, the last slide, the control of microbial growth. While most microbial methods are effective, especially the biocides, they're not uniformly effective against all microbes, especially against endospores. The compounds discussed in this lecture are not generally useful in disease treatment of patients, except for the antibiotics. So don't go out and treat yourself with a disinfectant by drinking it, because that would be toxic, okay? Meaning they are good for treating surfaces and objects, but you can't take them internally. The exception are the antibiotics, okay? Any question about any of that? All right, that's it for this lesson. I'll see you at 2:30 for the lab. Come on.